So, insulin-like growth factor is known to increase the prostate cancer risk by stimulating of cellular proliferation of the prostate, and insulin-like growth factor binding protein is reported to prevent the prostate cancer by blunting proliferative effect of insulin-like growth factor. One is on prostate cells. So 125-dihydroxycholecholesterol reduces the prostate cancer cells by multiple mechanisms, which include the cell cycle arrest, the induction of apoptosis and regulation of growth factor signaling. So this is overall mechanism. So which are the risk factors that they have been effect of the prostate cancer? Majorly we are talking about the insulin resistance. So this implication of the obesity. So whenever obesity, so what I want to say is prostate cancer is multifactorial, whether it is genetic or environmental. So obesity and old age are 99% of the people are suffering with the more than 50 years of old people. So this is the insulin resistance, how it will be effect on the, so hyperglycemia, nothing but diabetes and hyperinsulinemia, these are the major play role into the prostate cancer. So this is whenever increases of gluconeogenesis also it is major. So that time steroid hormonal binding globulin will be released. So when steroid hormonal binding globulin will be free form means, so testosterone is released, then this is entering into the cellular proliferation mechanism. So ultimately prostate cancer will be occurred. So this is the all the pathways is going on to the obesity and insulin resistance is the major role of prostate cancer. Next. So this is simple and schematic diagram of the prostate cancer. So physical activity. So lack of physical activity or low physical activity. So that leads to androgen cells will be increases. So ultimately androgen receptors activity will increases. So cellular proliferation that leads to somatic mutation. So ultimately prostate cancer. Abdominal fat, that means obesity. Whenever high fat or obesity, that time what will happen is, so abdominal fat will be increases. So abdominal fat increases means insulin resistance is increased. Insulin resistance also synergistic activity of insulin-like growth factor. So insulin-like growth factor or insulin resistance it will be entering into the cellular proliferation, ultimately somatic mutation. So that leads to prostate cancer. So vitamin D resistance also it is suppress the prostate cancers, and antioxidant vitamins also suppress the prostate cancer. Objectives is published. So objectives is to estimate the prostate specific antigen, to estimate antioxidant vitamins, and to evaluate the insulin resistance by homeostasis model assessment of insulin resistance. So material methods. In our study, 30 prostate cancer patients aged 60 to 80 years were taken as a cases. So 30 normal age matched disease free persons were taken as a controls in both the groups. Antioxidant vitamins and insulin resistance status was studied. So this is the main material methods. Estimations of antioxidant vitamins in by high performance liquid chromatography. We have HPLC, atomic absorption spectrophotometry. All the instruments we have advanced research center in Narayana Medical College. So to estimate the prostate specific antigen by immunoenzymatic assay, to evaluate insulin resistance by homeostatic model assessment of insulin resistance. See, this is the estimations of plasma by GOD method, glucose oxidase and peroxidase oxidase. Homeostatic model assessment, this is the calculation how we are calculate the homeostatic model assessment of insulin resistance. Results. Serum vitamin E and vitamin C values for cases was reduced. Probability less than 0.05 significantly than controls. In the present study, the value of homeostatic model assessment of insulin resistance significantly probability less than 0.05 cases when compared to controls. The results of the present study consist with the finding of showing an association between the increase of insulin resistance, so low level of the antioxidant vitamins status, the pathogenesis of prostate cancer. So this is how scavenger mechanism free radicals will be involved into the antioxidant vitamins like vitamin C and selenium. This is all involved into the which is major enzyme involved into the glutathione peroxidase. This is the synergetic action of the both selenium and vitamin E. Vitamin E is alpha tocopherol, which is active form of vitamin E. So this result showing prostate specific antigen and insulin, fasting glucose and homeostatic molar receptors of insulin resistance, and this all will be increases whenever prostate cancer is there. So increases of this all these things, prostate specific antigen, it is a marker of prostate cancer. Then also increases of insulin resistance and insulin level and fasting glucose and insulin resistance. So these are the decreases. Why? Because these are the antioxidants, alpha tocopherol and ascorbic acid. These are the both are antioxidants. So our study is when compared to controls, so antioxidant status will be decreases. Then these